I was right to go. First things first, there are 19,728 confirmed aggregate cases of coronavirus throughout Victoria since the beginning of the pandemic. That's 51 new cases since yesterday's update. I'm sad to say there have now been 701 Victorians who've passed away as a result of this global pandemic. That's an increase of 7 since yesterday's report. 4 males in their 70s, 2 females in their 80s, 1 male in their 80s. 4 of those 7 deaths are linked to outbreaks in aged care. Of course, we send our best wishes and our sincere condolences, our sympathies to each of those 7 families. There are 169 Victorians in hospital. 17 of those are receiving intensive care and 11 of those 17 are on a ventilator. There have been a total now of 2,443,583 tests that have been received. That is 14,805 additional results received since yesterday. On that point, those numbers obviously are higher than we had earlier in the week, but still we'd always like to see those numbers up as high as possible. So everybody who's got symptoms, even the mildest symptoms, and as soon as those symptoms begin, please come forward and get tested. There's now more than 200 test sites across the state. We will come to you if you're unable to go to a testing site. It's just so important. Logic tells you, and the strategy is best when we have the clearest picture of how much virus is out there, and that's dependent upon people going and getting tested. So again, we urge all Victorians who've got even the mildest of symptoms, come forward, get tested, isolate at home until you get your result. 90+% of those results are now back within 24 hours, and that means that we can have the clearest picture of how much virus is out there, where it is, patterns and chains of transmission. It makes our response collectively much more effective, and it will get us to the other side and into that COVID normal much sooner. There are 4,306 cases with unknown source. That's 31 since yesterday's report, so they'll be closed out from investigations, not just from yesterday, but from multiple days before that. There are 251 healthcare workers who are active cases. We send our best wishes to them, of course, and we thank them and all of their colleagues for the amazing job they're doing right across the state. They are true heroes, and we are all indebted to them. There are 1,483 active cases in Victoria, so the number of active cases continues to fall. That is very pleasing news. In terms of the regional metro split, there are 72 active cases in regional local government areas under stage 3, so regional Victoria. That is, again, very pleasing to see those numbers from a very high base. They've stabilised, they've steadily fallen, and now we're very pleased to be able to report that there were no new cases in regional Victoria overnight. Colac has 29 active cases, Greater Geelong has 11 active cases, Greater Bendigo just 2 active cases, and Ballarat no active cases. So communities that were of some concern to us a few weeks ago, those communities have done a mighty job in following the rules, getting tested. Indeed, all regional Victorians have, from the smallest of country towns to some of these bigger regional cities. These numbers are low, and that is in large part due to the amazing efforts that regional Victorians have made. The rolling averages from the 27th of August to the 9th of September, Metro Melbourne is 70.1, regional Victoria 4.5. What that shows us is that regional Victoria are quite close to being able to take perhaps not just one step but 2. We have to be heavily caveated in terms of that. We need to make sure that we continue that trend going forward, but we're confident that those numbers are low and getting lower, and that means that there'll be an opportunity quite soon for us to take some significant step or steps towards that COVID normal for regional Victoria. We'll then have to defend that in terms of testing numbers remaining high, people following the rules, COVID-safe work plans, particularly when it comes to workplaces large and small. Jill has joined us today and will speak in just a moment to those efforts, both in metropolitan Melbourne and in regional Victoria. WorkSafe are working incredibly hard. And industry, I think, is really stepping up. Even those really high-risk industries, people are doing an amazing job in being as safe as they can be. And that's why a feature of these last few weeks, these last few months even, has not so much been big outbreaks in high-risk centres. There have been some, but it's a very different place. And that sense of continuous improvement, industry by industry, workplace by workplace, has made a massive difference. Just before I make a couple of general comments, can I also give you the aged care outbreak? There are now the total number of cases associated with aged care. There's 763 active cases. Those numbers continue to fall. We are pleased about that. That sense of stability has come to aged care from a position of real crisis. In terms of aged care shifts that have been worked by hospital staff, 4,229 shifts have been filled in aged care facilities. That is a massive effort, and again we say thank you to each and every one of those hospital staff who have done an amazing job in bringing stability to that sector. In disability facility settings, there are 16 active cases, 10 staff and 6 residents. So again, vulnerability is a key in those settings, and those numbers are stable and indeed falling. Beyond that, I just want to make a couple of comments in relation to some of the rules that we have in place. As I said yesterday, the key to driving down case numbers is driving down movement. If you don't limit movement across the community, then you will not limit case numbers. We won't have 51, we won't have 41, we won't have a falling number each and every day. We won't get to the point where we can open up. So whether it be the curfew or the 5 kilometre rule or rules around how often you can leave the home to go shopping and how many people can leave the home to go shopping, all of these rules are about limiting movement. Some of them limit movement in and of themselves, and some of them make the job of enforcing the rules in a broader context easier and simpler. If the curfew was removed tonight, then the only change would be that you could go potentially for a jog at 11 o'clock tonight. You could maybe go shopping at 11 o'clock tonight if the supermarket were open. That's not been the case. Supermarkets, whether there was a curfew or not, have limited their trading hours. That's a decision for them. But ultimately, having the curfew simply makes the job, the very difficult and critically important job of Victoria Police, and I will thank Victoria Police, every member and their families who are all contributing to the enforcement of these rules. And it's our job to make sure that that task, it's never easy, but we've got to try and make it as simple as we possibly can. And there are no lawful reasons to leave your home other than to go to work if you're a permitted worker, for which the curfew does not apply to you, to get care if you need that care urgently, and then the curfew does not apply to you. The only limitations, other than going and conducting activity, gatherings in homes, which are unlawful, would be doing your exercise within inside the curfew hour, so doing your exercise between 5 a.m. and 8, soon to be 9 p.m, or going shopping and having to go shopping during the day or the early evening, as opposed to going shopping for the things you need when you need them very late at night. Now that is a sacrifice, but I would simply say I think that is worth it when it comes to limiting movement and limiting case numbers. People are of course free to have different views. The term curfew is rather loaded, but at the end of the day it is effective, just as all of these rules, as regrettable as they are effective in reducing movement. And if you don't reduce movement and the number of people that you come in contact with, then of course you don't reduce the risk of this virus spreading. And of course, whilst ever you have a high risk of the virus spreading, then the rules stay on for longer and you can't open up. That's the basic logic of this. Common sense tells you that we won't need a curfew forever. We will need it for so long as it serves a useful purpose in helping police to enforce rules that are making it more likely that we can open and stay open. Those rules will come off, as we have indicated, through that safe and steady roadmap. I know some people, many people, myself included, would like all of those rules to go away as soon as possible, but tomorrow, the next day. But that would neither be steady or safe or the responsible thing to do. So I want to thank every single Victorian who is playing their part, and that is the vast majority who are following the rules, doing the right thing, and that's why these case numbers continue to fall. And that's why, for instance, in regional Victoria, we are very close to being able to take substantial steps towards that COVID normal. That's the product, it's not by accident, it's the product of having rules in place, making them easy to defend, easy to enforce, and the collective efforts of literally millions and millions of people all doing their part. There are some who don't, but let's not see the actions or the conduct of a very small number of people in any way detract from the amazing sacrifice that so many Victorians are making. That sacrifice must count for something. Opening up too much too soon will mean it counts for exactly nothing. That's not fair, that's not right, and that's not the strategy that I will put in place. I might ask Alan just to make a few brief comments on any of the data for the day, and then Jill's going to take us through some of the work that WorkSafe has been doing to make sure that every business, every workplace across the state is as safe as it can possibly be.
Thanks, Premier. I probably don't have a whole lot to add. Just noting that the average number of cases has come down to, in Metro Melbourne, to 70 per day over the last 14 days, with 154 that are unknown source in total over the last 14 days. And in regional, 4.5, as mentioned, and 8 of those are unknown source. We're still looking, obviously, into the last of those cases to work out when the 14 days will be up. But obviously, I'm sure all my friends in regional Victoria will be holding their breath, making sure that nothing else comes up in the next week or so. But we hope that will be sometime later next week. I thought I'd probably just mention something about the modelling. It's got a lot of commentary, and just to say that modelling is only one piece of information that we're using to decide on these thresholds that we're doing. And there is going to be a lot of judgment as we get to low levels. So clearly in regional Victoria at the moment, things are looking fairly good. We're not seeing many unknown source cases. The cases that we have, we know where they are. In Colac is probably a very good example of this. There has been a outbreak, so one case that arrived in Colac resulted in 30 secondary cases. But we know where they are. We know we think we've got that under control, and they didn't have any cases yesterday. But obviously a situation that we're keeping a very close eye on. And these are the sort of factors that we're going to look into as we make that judgment about whether we can transition to that third step to relax some of those restrictions. But in terms of the 5 cases a day is not an absolute hard and fast rule, and the date is not a hard and fast date. We need to be looking at this every day. We're going to be looking at the improvements that have been made to case management and contact management. And I thought I'd just give you some comparisons about where other places were at a similar stage. So in New Zealand on the 27th of April, as they started to open up, they had 5 cases a day. New South Wales on the 15th of May, 3.8 cases a day. And in metropolitan Melbourne on the 1st of June, we had 6 cases a day, but we had more unknown source cases at that time. So really this does point to that we need a substantially lower number of cases than we have at the moment, but we are getting there. It wasn't that long ago that we were talking about 500 and 700 cases a day, and now we're at 51 cases for yesterday. So I think that's all I wanted to say, and I'll hand over to Jill.
Well, good morning, and thank you very much, Alan and Premier. And I'm really delighted to have an opportunity to update you on the very important work that WorkSafe are doing in order to make sure that our workplaces and employees and contractors and those that visit them are as safe as they possibly can be and are making their fair contribution to the reduction of the transmission of corona. Now, since the 20th of July, there's been 3,302 inquiries and visits to workplaces in high-risk industries. We know, and the government's been working very hard with employers, industry leaders, union leaders, and many others in order to ensure that we're getting in place in so many workplace COVID-safe plans. And an important part of having a COVID-safe plan in place is also understanding that WorkSafe and many others may inspect you and that there are real legal consequences for those that don't comply with the law. I'm really delighted to let you know that there have been many significant improvements in the way in which businesses have been responding to the challenges of managing corona transmissions and the potential threat of that in their workplace. It's important to know and to understand that when WorkSafe visits, there are a range of legal consequences. And so essentially, they are legal obligations around people complying with the CHO directions. But of course, there's also the Occupational Health and Safety Act. And the Occupational Health and Safety Act means that WorkSafe can put in place an improvement notice, and there's been over 300 improvement notices issued by WorkSafe in the course of doing this blitz. There are of course, prohibition notices, which is the next level of legal sanction for those that aren't complying with occupational health and safety laws. And then, of course, there are potential investigations and prosecutions for those that breach the Occupational Health and Safety Act with significant penalties, and many I'm very pleased to report are being very, very cooperative about trying to do everything they can to ensure that their workplace is safe and that their workers are safe. In terms of where we've issued notices of improvement to employers, I'll just step you through the kind of issues that WorkSafe have been working very hard to ensure are reduced and addressed very, very quickly in workplaces. There's been some examples of employers not allowing workers to work from home where that's possible. There's been some cases of missing and inadequate personal protective equipment. There's been examples, and there is surveillance occurring, of failing to maintain appropriate social distancing in some of those workplaces. In some circumstances, inadequate hygiene controls, a lack of health screening, and not having procedures to deal with a worker testing positive. Those have been at a very high level, the sorts of issues that WorkSafe have been responding to in terms of the work that they've been doing in the course of the Blitz. And in terms of what some of the more granular examples of those things, it's been things like an example is a transport and logistics company where reusable gloves are being used and they're not being laundered properly. Examples where in the construction industry, for example, where there are administrative staff that could equally and effectively do their work from home. Those are the sorts of examples. There's, I think, a very great desire by employers and employees to ensure that their workplaces are as safe as possible. And I want to thank and acknowledge all of the leaders, from representatives of workers to industry leaders, for the incredible commitment that they're bringing to try and make sure that where we do have people back in workplaces, that they're as safe as possible. In terms of work cover claims, we've had about 297 work cover claims. It's interesting to note that a bit under half of those are not people that have tested positive for corona, but it has related to things like mental health and wellbeing, other issues associated with working in this environment as well. Each and every single claim's been accepted, and again, WorkSafe is working very hard with employers to make sure that some of the new frontiers of what the workplace looks like in a corona environment, and for many people that's working at home, supporting employers and managers looking at trying to work out how we do that in a way that's safe, both from a physical perspective but also from the perspective of mental health and wellbeing. Again, I want to thank everyone, particularly the WorkSafe inspectors that are out there doing this work, and I want to encourage both employers, employees to ring WorkSafe or the police assistance line if you've got concerns or queries about a safe system of work. People are very, very ready, willing and able to do whatever it takes to make sure that we use workplace as a really significant platform, that we start really significantly reducing any of the risks of transmission. And I think the blitzers are making a significant contribution to that end, but we remain very, very ready, willing and able to help any others that require assistance or intervention. Thanks very much.
How many businesses have been fined or shut down as a result of not meeting those rules?
Look, there's been a number of different responses, Richard. So, of course, some of those are breaches of CHO directions, and so we have an outbreak team, and the outbreak team that has been established, and that involves both Victoria Police, WorkSafe and authorised officers. Their response around any potential risk is to try and ensure that that is a workplace that, where needed, gets shut down within 24 hours, and that's the focus. And in terms of some of the recent outbreak challenges, that indeed has been the response. There are, on top of that, of course, a number of improvement notices. So sometimes the risks are less serious ones that where we support employers to try and get proper safe systems of work in place. And as I said, there's been a number of improvement notices that have been issued, and most of those, I'm happy to report, have been complied with. So that is the very good news. Of course, WorkSafe have a number of investigations around breaches. That's a historic period of time, not since, I suppose, some of the more recent activities around high-risk industries and when we've initiated the Blitz. But more generally, there is about 30 ongoing WorkSafe investigations on foot at this point in time. They are, of course, an independent regulator and make their own decisions around potential breaches. So some of those may relate to corona, but also other occupational health and safety breaches that they've also identified in the course of their inspections.
How many workplaces have actually been prosecuted, though?
Well, prosecutions take a significant period of time. So those 30 investigations, so investigations are the step before a prosecution is initiated, and that is in the course of evaluating and developing a potential brief of evidence that is then used as the basis to make a decision as to whether or not they're going to be prosecuted. And there is some period of time between the start of an investigation and when a prosecution might be initiated. And so, again, I'd refer you back to WorkSafe, because they make independent prosecution decisions, and not matters that the government can either direct or influence, and that's as it should be as an independent agency. But as I said, there are currently 30 investigations underway that may or may not lead to prosecutions.
Just a question for the Premier. Sure. Premier, yesterday you said that the curfew made it easier for police to enforce, yet today the Police Commissioner says that they weren't consulted.
Well, the Police Commissioner and Police Command have, throughout all of our decisions, been really clear with us that they need rules that are as easily enforced as possible. And the curfew, together with 5 kilometre rules, together with, there's a very long list of different decisions that we've made over these last few months, and indeed since the beginning of the pandemic. It's always been clear to us that we need to make the job of police, the amazing work that they do, as simple as possible. And I'll go back to the point I made off the top. There are very few lawful reasons that you can leave your home at any hour of the day. The curfew doesn't change that. It simply means that it is much easier for Victoria Police to make that assessment about whether someone should or should not be out of their home. And it does send a very clear message to people that there is a very real risk that if you are out of your home for an unlawful reason between 8 p.m. and 5 a.m, or soon to be 9 p.m. and 5 a.m, there's every chance that police will catch you and police will fine you. And what that's done is it's limited the amount of unlawful movement. That's the key point here. Unlawful movement that is against the rules, and movement that does nothing but potentially spread this virus. So police are doing an amazing job, and with the rules that we have in place and any decisions we make in the weeks and months ahead, we'll always be minded to make sure that they are as simple and as enforceable as they possibly can be.
Police say it wasn't their idea and the CHO said it wasn't his idea. Whose idea?
Well, as I've said to you before, Rachel, if people find fault with that rule or any other rule, then they can find fault with me.
I'm not talking about whether there's fault with the rule, I'm just asking whose idea it was.
Well, decisions are made by groups of people, and I can't necessarily pinpoint for you the exact individual and the exact moment that it was suggested that we put a curfew on. And what I'm saying to you is anyone who is displeased with that or doesn't think that's a proportionate measure, well, that's a decision that I've made. All these decisions are ultimately decisions that the government has made, and as the leader of the government, I'll be accountable for that. But there's no denying, simply no denying, that those measures have made the job of police never easy, but it has made it clearer cut, it has made it somewhat simpler, and driving down movement, there's no denying. Less movement means less virus. That's what all of these rules are about. And the curfew will come off when it is appropriate. And we've already foreshadowed that.
You keep saying you'll be driven by the evidence and the
Yes.
data, though. And isn't it a very reasonable question to say, what is the data and the evidence you have to justify the curfew? And isn't it okay for the public to ask to see that? If there is substantial evidence that illegal gatherings have come down because of curfew, shouldn't you be revealing the data? Because at the end of the day, we could have another wave of the virus. And isn't it really legitimate to know which measures were most effective so we know what to implement
Sure.
again?
I'm more than happy to try and get you some comparisons of some of the enforcement activity, pre-curfew and post-curfew, and I think what that will show you is that there are significantly less fines being issued for people gathering against the law in other people's homes. But let me get you that data. I'm more than happy to do that. I think it's important, though, not to fall into this trap where the only decisions the government can ever make about any matter are those that have been considered and advised by the Chief Health Officer. The Chief Health Officer wants and provides in many ways very detailed advice, and that's when those matters relate directly to public health. Matters of enforcement, matters of in many different areas. The government is free to go beyond. The government is free to make some administrative decisions that make the enforcement of the principles that the Chief Health Officer has put forward much more achievable. For instance, again, if you limit movement, then you limit the spread of this virus. And I'm happy to come back to you in terms of any data that will...
By how much, though, the curfew actually, the limitation of...
But then I suppose I'd flip the question and say to you, well, what's being limited by the curfew?
I mean, you said that the only other activities, like jogging at 11 o'clock at night, for example...
Hang on, let's go back to first principles. You can leave your home, one person, 1 hour per day, to go shopping for the things you need when you need them. That can only happen within curfew hours. So that means going to the supermarket at 8:30 p.m. or 10:30 p.m. or 2 in the morning, that's not an option. So that's a downside. The other reasons you can leave your home to exercise for 1 hour, soon to be 2 hours, and for some rec activity, to sit in the park, for instance. Obviously, that's not allowed outside curfew hours. So you wouldn't be able to go for a jog at 8:30, 9:30, 10:30, midnight. Okay? That's also a downside. The downside of not being able to do those two things in the dead of night is far outweighed, in my judgment, far outweighed by the fact that we are seeing case numbers fall, and those arrangements will be able to change. We'll be able to remove that curfew. The only things, apart from those two examples, the only thing the curfew makes almost impossible is illegal activity, leaving your home for reasons you are not lawfully allowed to do so. That's the key point that I'm making.
Isn't there an argument that the curfew actually increases?
Couldn't we, if the curfew didn't exist, there were other laws that we could use to fine or charge or whatever for those people that are committing illegal activities. So if someone's out trying to score drugs,
Yeah.
there are other fines or charges that could go
Yes.
against that person.
Yeah.
So
I'd channel to that exact point. If you were out and you were fined, and you were out in breach of the curfew, and you were reasonably believed to have committed a number of other offences, then you won't just get the curfew penalty. Police would always reserve the right to charge you with whatever you needed to be charged with, and then that would have to work through a process, of course.
Well, the only thing you could possibly do is go out for a jog. But that's exactly what some people want to be able to do.
Well, and again, I apologise for the fact that it is not possible for us to be. This is the whole thing. There will, from time to time, and we saw this prior to the curfew, there will be people who decide to make decisions, trying to assert that they have the right to make whatever decisions they like, even though those decisions aren't just about them; they're about risking the health and well-being of everybody. And every exemption, every avenue that you give to people to be as close to normal as possible, there will be some people who will try and take advantage of that. And that gets really challenging. It gets really challenging for Victoria Police. This is binary, I know that. It's not the decision that was made easily. It's not a decision that anyone enjoys making, but it is effective because it drives down movement. It'll come off at a point, and then people will be able to not just go for a jog at 11 o'clock, but the total number of reasons to leave your home will also expand. We'll get much closer to, firstly, the 4 reasons to leave, then almost unlimited movement, and at that point there'll be no need for a curfew, and at that point the curfew will come off.
You just said that
curfew was a loaded phrase. You use those.
Well, it is. It is,
So,
I think.
given that and mental health and all the reasons that just have been spelt out, you can't leave your house anyway because of all those 4 reasons.
But some people had been, Rich.
Yes, yeah. Why not remove it then? When people talked about needing hope this week, why not remove this loaded term?
Well, again, I've tried to be frank and acknowledge the fact that it perhaps has a meaning that goes beyond the practical effect that it has, but we're not removing it because it works. And if we remove it and make the job of police even harder, because it's not easy to make sure that people are doing the right thing, then that will just mean we potentially have more cases, and opening up safely and steadily is further away than it should be. This is the right decision. It is limiting movement. It is making the very challenging work of Victoria Police just that little bit easier. And on that basis, limit movement, limit the virus. It's no more or less complex than that. And when we get down to numbers that are low enough for us to begin taking those really significant steps towards opening up, a curfew will not be needed.
Premier, you've just said before that the government can make administrative decisions without the advice of the Chief Health Officer. How many other captain's calls have you made?
I wouldn't describe it in those terms. If you want to describe it that way, then that's entirely a matter for you.
It has been described as that. You said it was ultimately your decision yesterday. How
Well,
many
in
other
that-
calls
well,
have you made without the advice of the Chief Health
No.
Officer?
But see, this is not the thing. This is not the issue. The government reserves the right to make decisions to operationalise advice from the Chief Health Officer. The notion that the government can't do anything whatsoever unless the Chief Health Officer provides it in detailed advice, that doesn't make any sense. And that doesn't operate, that's not the principle that operates here or New South Wales or any other Australian state or at a national level. If you want to put it to the Prime Minister, has he ever acted beyond, in any sense, the advice that Brendan Murphy or Paul Kelly has given him? I think the answer will be he has. You always have to reserve the right to operationalise and deliver the advice of the medical experts and the principles that they want achieved. So, for instance, limit movement. Okay, how might we do that? What are the different ways in which we can do that? And a curfew, as challenging and as difficult as it is to make a decision to impose something that has not been imposed before, there is simply no denying that it has played a part in limiting movement, and that limits the number of cases, and that gets us open sooner, and it allows us to stay open because we drive those numbers down so low. How you want to describe that is entirely a matter for you.
Respectfully though, Premier, can you see how members of the public though would see this, that, hey, Brett Sutton has said this, but you're now saying this, how can we trust you and follow the rules?
Well, I wouldn't see it in those terms. What I'd say is that we've got a clear strategy, numbers are falling, the strategy's working, limiting movement is a critically important part of that, and our approach to that will not be changing. Sure, Michael, yes.
People have contacted us and said shift workers, for example, that work until 7, 8, 9 p.m, they might not have time to go and exercise before, so it does have an impact on their lives.
And I'm not for a moment saying it doesn't.
Sure, I accept that. The question then becomes, to limit that movement at night time, do you think you could adopt a more targeted approach? For example, we've seen during this that you've increased fines for certain offences, or there's been more police patrols or things like that. Do you think you could rethink it and make it more specific as opposed to this broad brush curfew?
Oh, we're always open to having a look at how things unfold, and circumstances change each day, each week. And that's the exact point I'm making. Curfew will come off. It's not there forever. It's not there for each and every step along this journey towards a COVID normal. It's utility, the judgment about how much it gives you versus what it costs, that balance will change. We're not at that point yet. We're not at that point yet. And if we just look back a little while ago, pre that curfew, and indeed pre the limitation on the stage 4, the number of reasons to leave your home being substantially reduced, we did see, whether it be Airbnb parties or lots of other activity where people were gathering against the rules and not just potentially spreading the virus, actually spreading the virus. So again, the only way to drive down numbers is to drive down movement. That's what sits behind every one of these rules. And if there was a different way, to limit the spread of this, then of course we'd choose that. But that isn't the position we're in.
Further to Michael's point, have you looked at whether the curfews actually increased the concentrations of people in places like supermarkets? Because, I mean, as he was saying, often shift workers might finish work, or people might finish work at home. They might want to go and get their groceries at 9 o'clock at night. They can't do that. Instead, everyone's at the supermarket.
Well, I suppose,
during the non-curfew
well, look, I'm happy to
hours.
try and come back to you on that point, but I think what you'll find is that pre the curfew, a number of the big supermarkets were not trading anywhere near their normal hours. They were already closing, I stand to be corrected, and I don't have the exact closing times, but they weren't operating. Many of them are 24-hour stores, many of them go till midnight, and many of them weren't doing that. So there was already a concentration. The other point to make too, though, is I think it highly unlikely that it's increased in any meaningful way that the concentration of people in a given space at a given time, because of course there are rules about shopping for what you need when you need it, shopping one person from each household once a day, all of those things. I think they have a cumulative effect, and probably a much bigger effect than what a number of people who might have to shop in hours that are different to their normal pattern. The curfew will be on for no longer than it needs to be on. That is to say, once there is no longer a clear imperative to drive down movement and therefore contact with other people and therefore the potential transmission of this virus, there won't be a need for a curfew. We're not at that point yet.
Is that a number of days? Is that a number of cases per day that you're looking for to lift the curfew? Is there a threshold that you want?
The plan talks about the 28th. It may go beyond that. We will look at the data. We'll look at where we're at. We'll look at how close we are to achieving the very low case numbers that are essential to opening the place up. It's no more complex than that.
Premier, the community legal centres that I've spoken to and youth law that I've spoken to, they've not had a single public health infringement overturned. Now, bearing in mind that they represent the most vulnerable in the community, they represent Aboriginal and Torres Strait Islanders, they represent people who speak English as a second language, they've not had a single fine overturned. They take on cases where they think the fine's been issued inappropriately or without good reason. Is that a concern? Is there a real concern that the most vulnerable are being disproportionately affected by this policing?
No. Ultimately, those matters, whether they're overturned or not, that's not a political judgment, that's not a policy judgment. Each of those matters are dealt with on their merits, and despite the types of clients that would typically be assisted by a community legal service, that has no bearing on the matter. The facts of the matter will be looked at, the circumstances of the matter, and a proper impartial judgment will be made about whether the issuance of that fine was fair. That's a process that's well at arm's length from the government, is independent in nature, and is based in facts and nothing else. Ultimately, if you want to put it to me that those vulnerabilities, which are well understood, are somehow more important than the overall vulnerability of many hundreds of thousands of Victorians who, if they get this virus, will either be gravely ill or die, I don't think they are in any way equal. I think there is a much greater vulnerability here, and the best way to avoid a fine is to follow the rules. If however, though, for whatever reason, you were completely unaware of those rules or you had a legitimate case to make, then there's an impartial process to work that through.
Premier, new modelling shows that Melbourne stands to lose $110 billion over the next 5 years. The Lord Mayor says you need to start getting the balance right between lives and livelihoods. Do you have?
I've had many conversations with the Lord Mayor, and we work very closely together, and we'll be making some announcements quite soon about a shared effort for the City of Melbourne. There's no question that there's very significant costs associated with this global pandemic, whether it be in our capital city or in the smallest of country towns in our state, and the same goes for every other state and indeed every other country across the world. The real challenge here is let's get the numbers down, let's open up and stay open, and then let's begin what's going to have to be the biggest repair job that our state and indeed our nation has ever seen. And the government that I lead stands ready to play a massive part in that rebuilding exercise. But you can't get to the economic recovery until you've dealt with the health challenge. Otherwise, you're just bouncing in and out of lockdowns and nobody can plan with any certainty. No one can rebuild and repair. We have to try and avoid that, and that's exactly what we're doing.
When will we get an announcement on business support?
We'll make that announcement soon.
A few days, a week?
We'll make that announcement soon.
Can you please explain, you said you don't want to be bouncing in and out of lockdown.
That's certainly our aim. We do not want to do that.
What does the modelling show, even if we get to the COVID normal, what are the chances of it ticking back up?
I think that when you get to the point of having driven case numbers down to very low limits, if I can, just give me 1 minute and I want to put a bit of background behind that, Mark. These numbers are our targets. These are our aims. It could be that the tail of this virus is more stubborn, the tail of this second wave is more stubborn than even some of the most rigorous and robust modelling that's ever been done in our country outlines. That's why, second point, is each day the actuals always beat the assumptions you've programmed into a model. The data, the real data, actually always trumps the model that you've built. Even a complex, robust model that with 1,000 different inputs run multiple times by not one university but in fact 2. So that's where we want to get to. Whether that's achievable, that's a matter for every single Victorian. Whether we get tested when we've got symptoms, whether we follow the rules, whether we all keep working as hard as we can to track and trace and test, whether we continue to see outbreaks, for instance, like the Colac one. No one wants 25 or 30 cases in any town, but it was pounced on and it was shut down. Could have been many, many more cases, and I congratulate everybody involved in that, from the community all the way through to the regional public health team out of Barwon Health. The notion that if we had just a few cases once we had got to that normal and we were fully open, and that would trigger lockdown, that's wrong. That is not the strategy. That is not the strategy. New Zealand, as I said yesterday, the elimination strategy is not just about getting down to zero, it's staying at zero. And if you get 1 case or 2 cases or 5 cases, that's the equivalent of having 50 or 100 cases over multiple days. This is about suppressing it, but in order to keep the numbers low, you have to get them very low. That just stands to reason. And that's why the modelling tells us, and it was modelled at 3, 5, 10 and 25. If you opened at 25, the chances of staying open for very long are very low. However, no one should be in any doubt, and I want to be as clear as I can be. We will have cases. We will have outbreaks. And they will be a feature of 2021 or until we get the ultimate fix to this, and that's obviously a vaccine. But 1 or 2 cases provide, and that's the thing. Once you get it down really low, you can, with great confidence, plan to keep those numbers low. And an outbreak of 5 or 10 or 20, you can pounce on that really quickly. You can contain it, and without having to go to measures that cover everybody. It's a much more targeted approach. But if you're chasing 500 cases a day, you really can't do that. No contact tracing team in the world, no matter how big, could, without imposing rules that cover everybody, hope to pull up 300, 400, 500 cases in a day, and never forget the 3 or 4 close contacts for each of those. That just gets, you just can't do it.
I understand that our COVID normal is 0 cases according to the plan that you put out. So it's not 300. Why so low? Can you explain how that definition of our COVID normal came to be 0 when it's likely we might see 1 or 2 more cases?
Because if you don't get it down to low numbers, you won't keep it at low numbers.
0 is not low. It's 0.
Well, but it's not. Yeah, but this is the key point. It's not about every day for the next 12 months has to be 0. And if it was 1 case, we would lock the place down. No, it's simply this. If you don't give your public health team a fair fight, if you say, righto, everyone wants to open, let's open, even though there's known cases, say 25 cases a day, and there's always more cases out there than you know, because not everyone who's symptomatic gets tested. Mystery cases are by their own nature, they are mysteries, and every mystery case there's at least someone else who they got it from and their close contacts. Let's open up even though we know there's well more than 25 cases a day. There's plenty of virus out there. And then you just go and chase all that, will you? You go and do something that is incredibly challenging, but we'll let everyone go back and do everything normal. If that was an option, of course you'd choose that because it'd mean you'd be open quicker, but you wouldn't be open for very long. So you've got to get the numbers down very low, but there will, as I've said all along, there will be cases as part of the COVID normal. There will be outbreaks. But if you aim to keep those numbers low, then you have to first get them low so that our tracing team, our public health response, our hospitals, everybody involved has got a fair chance of being able to do that. The numbers that Alan just quoted to you in terms of New South Wales didn't open at 50 cases a day or 25 cases a day. They opened at less than 5 cases a day. And then they're able to pounce on those outbreaks, and that's exactly the position that we're going to get to. And Colac would tell you we're very, very close to getting to that point. The regional Victorian numbers, the fact that we are under the 5 cases a day now in regional Victoria. Rich asked me about hope. Everybody in Melbourne can look to the situation in regional Victoria and say that the strategy's working, and they're about to take steps based on science and data and modelling and their hard work. And that's exactly the position that Metropolitan Melbourne will get into. It'll take a little bit longer because that's the nature. The outbreak here is different. The wave here is different. But what's about to happen in regional Victoria is a positive thing. It's the strategy working, and it should be a great reassurance to Metropolitan Melbourne that we can get these numbers down. When you get them low, you can keep them low. That's what's happening in regional Victoria at the moment.
My question is on regional Victoria. There is plenty of LGAs that don't have any cases. They're nowhere near Melbourne. They're on the border, places like Gippsland, Mildura. Why not let them out now?
Well,
and you mentioned last week that you were keeping a close eye on the Geelong corridor.
Yep, and the numbers there are very good.
Yeah, why not leave Geelong and the Colac area under, tougher lockdowns, but let the rest of the state out?
My
a lot of people
answer is not
about why Gippsland is being treated the same as Colac.
I understand the question, and my answer hasn't changed from the last time the question was asked. If we were going to be leaving regional Victoria in its current settings for 8 or 9 or 10 weeks, then we would have divided regional Victoria up into half a dozen regions, for instance, or even more. But I just say to every regional Victorian, if you do that, if you start drawing boundaries, you have to defend those. You have to have police at checkpoints. Otherwise, communities that are open, where quite close by the community is not open because it has more cases, that community that's got no cases, they are jealously guarding that. There's a point of pride for those communities. I have regular correspondence from at least one of those communities multiple times per day. I don't always pick up the phone because I'm sometimes doing other things, but I have a unique understanding of how frustrating it is for those who don't have much or any virus and the fact that rules apply to them. If we were asking those communities to wait a long period of time, then we would have divvied up the state into lots of different zones. As it stands now, and I can't guarantee that this is the case, but if the trend continues and the numbers are very promising, we'll be able to take a step or steps as early as toward the end of next week. And that then avoids having to divide the state up into regions, have police enforce all of those boundaries, and potentially have, because that's the other thing too, if you've got certain venues open here, a community not too far away that's closed, people will go where the hotels are open, where the restaurants are open, where a group of settings that are closer to normal apply. That common sense just tells you that. Again, if we were asking people to wait months, then we would have done a different set of rules. But we're not asking that at all, and it could be as early as next week that those triggers are met. If circumstances were to change, and this is the point of saying that Geelong was not on notice, it was on close watch. We're carefully watching the numbers there, as we have been for a long time. Those numbers are stable. Those numbers are, at this stage, not holding regional Victoria back from moving as one set of rules, moving in one or two steps. That's every single part of regional Victoria.
Just a question for Professor Cheng, if I may, please.
Certainly.
Professor Cheng, do you believe that the public health benefit of limiting movement due to a curfew outweighs the concerns over mental health?
Yes, I mean, I think that having cases is that's troubling to mental health as well. And having, more cases means that we can't treat people in hospital. I do completely understand, and today is Are You OK Day. It's it's very important to support each other. I do absolutely understand the toll that this is taking on people. This is difficult, but we're almost there. We just need these cases to come down a little bit further, and then we can start, start relaxing things.
So you endorse the curfew staying in for longer?
Absolutely. Yep.
Can I ask about the modelling, Alan?
Yeah.
It appears that the situation of stage 3 plus masks wasn't modelled in the one that was released by you guys on Sunday. Why was that not even considered, even if just to show Victorians this would be an insufficient response as well?
No, that's not true. The masks were modelled as having an effect. In the original model, way back when they made it, they assumed that it had quite a large effect based on a paper in The Lancet. But in that paper, that wasn't really true community. It was a lot of assumptions were made about, mainly about hospital masks. So there's been more recent work done, and they showed that there was still an effect, but it wasn't quite as large as they had first assumed. That was modified, and that's an example of the modelers having to adapt and put in new information as it becomes available. And certainly that was incorporated into that model.
Did we model? I know that, say for example, it modelled what happens if we release restrictions in October if we're at about 25. Did we model what it would look like if we moved to stage 3 at that stage?
I'm not sure exactly which scenarios are modelled, but certainly what we do know is that in stage 3 plus masks, the effective reproductive ratio was about 1, meaning that we wouldn't expect anything to change from that point. Before, when it was just stage 3, it was clearly still increasing. Stage 4, obviously, it has come down quite significantly. So what I would expect with stage 3 plus masks is that it would hold at the level that that we came out at.
Can I just clarify, were gyms able to reopen in October under the plan?
And if I might just add to what Professor Chang's just said, and of course if you were at stage 3 plus masks and you had a effective reproduction number of about 1, so that means every infected person's infecting one other, then you don't get to stage 2. You just don't. You finish up locked in there for a very, very long time, and that's what stage 4 was about. I know it seems a long time ago, and it actually was quite a long time ago, when we stood here and said, look, we'd got down to 300-400 cases, but we would have stayed there for a long, long time. So that isn't the way that you get the place open again. That's kind of just a hovering. But the key point there is, it's hovering, but you're essentially closed. It's not like everyone's going about their business. It's not like you've got pubs and cafes and restaurants and workplaces and pretty much freedom of movement. Stage 3 is a lot less than that. Like 4 reasons to leave. That's something you want to pass through as quickly as you can, not be stuck in for months. In fact, even longer than that. I think that some of the predictions were that we'd still be sitting, if that was your setting, if we hadn't gone to 4, we would have been there pretty much close to the end of the year.
My question there is, and a couple of people have raised this, is that could well be true, and Alan's obviously the absolute expert, but why was that not even modelled and given to Victorians as evidence for this is why we're not doing that approach either?
Well, stages and different groups of rules are appropriate in a first wave. They might be appropriate in terms of defeating a second wave, but they're not necessarily appropriate when you ease out of that, particularly when it comes to things like community transmission numbers. Look, you can look at the second and third steps when we start to move towards 4 reasons to leave your home. That is essentially stage 3. And masks will be on, and it's not so different. The name of it is different, but the actual settings, Michael, are not wildly different from what we would regard as stage 3. Again, as I said, that's something you want to pass through. It's not something you want to lock in. Otherwise, that's just a recipe for keeping the place essentially closed. There's more personal movement, but there's none of the retail. There's none of the certainly from pubs and restaurants, cafes, that sort of activity. They are sadly closed under that stage. Gyms. Let me get you the exact wording. I don't have the document in front of me, but I will get you the exact wording. I know because there's an interplay between personal training, one-on-one, one-on-two, that does change over time. But in terms of gyms and other facilities that are indoors, let me come back to you with the exact date and the exact wording for fear that I don't give you an accurate answer. The other point though too, yesterday, I'm not sure who asked it yesterday, but the point about just as actually I do know who asked it, the issue around outdoor drinking and dining being an option. We will, I believe we are, but I'll make sure that we are now, looking at whether there's some of that gym type activity could move. They could maybe open up if there was more of it outside. And I think the exact example was that there might be some council bylaws that make that challenging. We'd certainly look to deal with those to try and find that sort of middle ground that gives people something as soon as possible, rather than them having to wait to the ultimate.
Premier, you said earlier that you can't pinpoint the
Go here
exact,
and then we'll... Yeah, sorry, Candice.
You said earlier that you can't pinpoint the exact individual or the moment that a curfew was decided. Why aren't Victorians entitled to know who decided to impose the strictest living conditions they've ever been under?
Well, I think I've probably challenged whether they are in fact the strictest, because they give effect to rules that are there anyway, whether there's a curfew or not. It is still illegal to go out, as I just went through all of those, and all those different examples. Ultimately, the decisions that the government makes, they are decisions that are made by groups of people. They are decisions that are made on advice. They're decisions that are made up by discussion, consultation. But ultimately, I'm accountable. I am accountable for the decisions that are made.
What advice was it made on, though? The Chief Health Officer said he didn't advise
Yeah,
it.
decisions
The
are
Police
made.
Commissioner said he didn't advise it. Who advised it?
Well, as I've said to you, the government always reserves the right to go beyond detailed advice, because
So it wasn't
those
made
who
on advice?
those who advise the government don't necessarily cover every single issue. They will often advise about what the aim is, what the strategy is, but the tactics to deliver that are a different matter. And the Chief Health Officer is not the government. The government gets advice where that's appropriate, follows that advice.
Who advised it?
Well, I'm not indicating that there was advice from the Chief Health Officer. The Chief Health Officer signed the orders. The Chief Health Officer signed the orders. The Chief Health Officer and the Deputy Chief Health Officer have been very clear with you that they support it in the fact that it limits movement. The decision has been made. I'm accountable for the decision. I'm the chair of the Cabinet and the leader of the state. And there's no denying that this is an effective measure to drive down movement and therefore drive down the spread of this virus.
Why won't you say who advised it, though? Who gave the idea?
Well, the government acts on advice where that's appropriate, and the government reserves the right to make decisions. The government is not there just to follow the advice of others. We are elected, we are chosen by the community to get on and get the job done. And my judgment and the judgment of my colleagues is that giving police the easiest mechanism to enforce rules is not only consistent with feedback that's been provided by Victoria Police all the way through, it's also consistent with logic. The decision's been made, and the curfew will remain in place, as we've outlined, not one moment longer than it needs to be, but it will be there for so long as it assists police in making sure these rules are followed. Because if the rules aren't followed, there's no opening up, because case numbers will simply go up. It is an encumbrance, it is inconvenient, but when you actually sit down and look at what activity is permitted, there are very few examples where the curfew is further limiting activity. I've dealt with shopping late at night, I've dealt with exercise late at night, and yes, there's a cost involved with that, but the benefit in lower case numbers far outweighs it.
Can I ask then, if you take advice and make decisions on a range of different things other than the Chief Health Officer, as the government, you say you have to do that, is the decision to impose curfew partly financial? And I mean in the sense of limiting overtime for police, limiting late. Does it have anything to do with
Not
that?
at all. Let me be very clear. There's no sense of raising money or saving money from the curfew. All it is giving police the easiest task possible and trying to drive down movement, because when you drive down movement, you drive down case numbers. And that means we get to open up quicker than we otherwise would, and we get to stay open because we've driven those case numbers down to the lowest possible level. It is no more complex than that. It is simply about it's a decision that helps deliver the strategy that the Chief Health Officer has advised us to get on and do, to limit movement. Every single rule, pretty much, is about limiting movement. If you make it simpler for Victoria Police to enforce those rules, they work better. It's easier, not easy, but easier for Victoria Police members. and I think they're entitled to a set of rules that they can actually enforce, and that's what the curfew does.
You say that it's
The only people that should be upset with the curfew are those who are planning to go out against the rules, because they're the only people that it means anything for. If you're out for a lawful purpose, then the curfew doesn't apply to you. If you're coming to and from work and you're a permitted worker, if you need urgent care and you're going to get that care. With the exception of people who might like to go for a jog late at night or go to the supermarket when it's not open late at night, then all this does is make it simpler for police to enforce the rules. I'm not for a moment downplaying the fact these rules are hard. They're absolutely hard. They are absolutely hard. But the more relevant discussion would be perhaps if people wanted to find fault with the reasons you can leave home, that's a more substantive debate. How these things are enforced that's not the same as the rules. That's just making sure that the rules work, and they are working because case numbers are coming down.
You say it's about making police's lives as easy as possible. Shane Patton came out and did 2 radio interviews today saying that he only found out about the curfew a few hours before it was meant to start. Why did you not consult with police at all?
There's consultation with police on almost a daily basis, and the consistent theme, the consistent request from Victoria Police, from the Chief Commissioner down, is give us rules that we can enforce. That is the consistent position. And there is, in some respects, whilst the choice to impose a curfew is not easy, it is very effective in making the complex and challenging and sometimes dangerous work that Victoria Police do just that little bit easier.
The Chief Commissioner said he only found out about it a few hours before it was meant to start, and he's now since had to make inquiries inside Victoria Police to see if anyone else knew about it.
Well, you'd need to speak to the Chief Commissioner about that.
Well, I'm telling you what he said. Do you think that consultation...
Well, I'm grateful for you telling me what he said, but he's the one that said that, and you'd need to speak to him about that. What I'm telling you is that right the way through, the consistent appeal, the consistent representations from Victoria Police, their consistent position is please give us the most easily enforced rules possible. And that's exactly what a curfew does.
Premier, 700 people have now died in Victoria. Will you hold a royal commission into the handling of coronavirus?
No, I've got no announcements to make about inquiries. We have an inquiry going on at the moment in relation to one area, one very important area where clearly mistakes have been made, unacceptable mistakes to me and to every single Victorian. We'll let that run its course.
The head of CSL has been quite critical of the roadmap today.
Let's go here and then we'll go.
Are you still planning on bringing hotel quarantine back in future, given how hard we're going now to get to zero?
Yeah, we'll have to have a conversation. I'll have a conversation with the PM at some point when we can take some of our focus that's currently dedicated almost exclusively to getting these numbers down. Once we get to that point, then there'll be a time when we can resume flights coming back here, and there'll need to be a quarantine arrangement, and we'll have further announcements to make about that in due course.
Is that not too risky, given everything that we're sacrificing now, the public?
Well, I think part of the tension here from the very beginning is that it's very challenging to deny Australian citizens the right to return home. That's not something I think that we could ever agree on. That's not something that we would do. So we've got to make, at the appropriate time, the best possible arrangements. That's exactly what we'll do. That's not tomorrow.
I was just going to say, but why Melbourne?
Well, because Melbourne has the biggest curfew-free airport in the country, and a lot of people live in Melbourne and Victoria and want to come back home. And at some point, it'll know it's simply not fair for us to say in indefinite terms that Sydney and other capital cities should continue to receive Victorians who want to fly home. So it isn't tomorrow. It'll need to be done very carefully, and it will be. But at some point, we obviously have to receive those flights again. That's not right now because the focus needs to be elsewhere. But the time will come when we can make that shift and we can resume those flights. And I'm sure that people who'll be returning home and to their actual home rather than having to transit via another city will be very pleased about that.
Some very public comments by the head of CSL today criticising the roadmap. What's your reaction out of those fair comments? And
look, it's not a matter for me to be a commentator on commentary. He can say whatever he likes. He's entitled to a view, as are every single Victorian. Every single Victorian's entitled to their view. What I don't get is the opportunity to endlessly speculate about these things. and be a commentator. We're very much in the middle of this, and we've got a strategy that's based on the best of advice. You know, the other thing too is, of course, he's got a really big job to do. He's got a vaccine to produce, and I wish him well. I wish him well and all of his team. That's a very important thing. Something that no doubt is taking up all of his time. So I wish him well in that. We've all got a stake in that.
Does that advice come from a range of experts outside of the government as well when you're making these
The
decisions?
advice comes from a range of experts. We have some of the very best researchers in the world that are based in this city, and we are using as many of them as we possibly can. I said yesterday, and I'm not directly speaking to the commentary that's in the paper today, but I said yesterday, we've got an amazing scientific and medical community in this city and state, and if you put 100 of them in a room, they'll come up with lots of different views. That's why they're so well. The science out of this city is so well renowned across the world. But ultimately, this is not a doctoral thesis. This is not a commentary from the stadium. This is not an academic exercise. At some point, you've got to call it, and you've got to say, right, this is the model, this is the plan, let's get on and get the job done. If only this was an endless theoretical debate. That'd be wonderful, because then people wouldn't be dying, the place wouldn't be closed, it'd be a very different place. But it isn't. It isn't. So opinion's always healthy, disagreement's always healthy. We certainly don't take these things personally. People are entitled to have their own views. But I don't get the luxury, nor have I ever sought the luxury, of being a commentator. We're in this, we're driving this, and we are going to get this job done. And you can't keep cases low in 21 if you don't get them low in 2020. And that's what this strategy will deliver and is delivering in Metro Melbourne and in regional Victoria.
Premier, have you taken any consideration about the mental toll that some people are feeling about the police presence and the way they're interacting with some people who are being stopped while walking back to their home with a coffee, for example? Is that a concern to you? And I'm not talking about curfew, I'm talking about more in general.
Oh, look, I think our police conduct themselves to the highest standards. I think our police are absolutely focused on making sure they play their part in delivering this strategy and getting us back to a COVID normal, finding a COVID normal and being able to defend it, making it long lasting as soon as possible. The work they do is very, very challenging. And look, I can't really speak to that other than to say that, we'd all like a different set of circumstances where we didn't quite have to have some of the rules we have in place and some of the work that's having to be done. We'd also, I think if you asked Victoria Police, they'd probably say they would prefer it if everyone followed the rules. But of course, that isn't the case. There'll always be some people who don't. The other point to make, I think, as well, Rich, is that, having communicated directly with the female police constable in Frankston, who was, it is alleged, was shamefully assaulted, it goes both ways. The notion that this is somehow an easy job for members and their families, I don't think that's right. They're doing tough work, and they're doing it well. They do it to the best of their abilities, and there's no doubt that the enforcement activity that Victoria Police and others have done and are doing is a very significant part of these lower numbers. There's just no denying that.
We saw footage the other day of two elderly women sitting on a park bench being, gathered around by 6 police officers, one of whom tried to snatch the phone of one of the women when she tried to video the interaction with the police. Is that really what we want to see in Victoria?
Well, no, we would prefer to see everybody simply following the rules. And Victoria Police have got a job to do. And, I've tried to be as clear as I can be for a long time now that the poor behaviour of some should not detract from the amazing work that the vast majority of Victorians are doing. Victoria Police's job is to interact with people in a professional manner. I believe they do that, and there are many more people that they will simply say hello to and are a reassurance to than those who might be breaking the rules, who of course would have a different view of the role of Victoria Police.
The most success. I mean, generally people are more likely to follow the rules if they have sort of, as pleasant a possible interaction with the people enforcing those rules. Was it really necessary to have 6 police enforcing the rules?
Well, I'm not going to comment on that individual matter. I'm not going to comment on that individual matter, but what I will say is that I get a lot of feedback from a lot of different people who are more than reassured to have Victoria Police out there in force and are nothing but complimentary about the fact that Victoria Police members will speak to them, will check on them, will ask if they're okay. That's the feedback that I get. Is that universal? Of course it won't be, and there's no universal feedback. But they're out there doing very important work, and they're doing it as best they possibly can.
You keep talking about personal responsibility and individuals doing the wrong thing, but we know that there have been many workplaces who have been doing the wrong thing as well. Did it take the government too long to realise that hospitals were a significant driver of spread? For a long time you kept saying that health workers were getting infected in the community. Very senior doctors and nurses were saying no, we're getting infected in the workplace. If we had have gotten on top of that sooner, acknowledged that sooner, do you think we'd be in a different position in terms of spread today?
No, I don't think that's a fair point to make at all, and I think if you're trying to compare workplace, the very beginning of your question, the notion that some workplaces have been reckless, some workplaces have done the wrong thing. If you're trying to infer that hospitals could be included in that, I would not accept that. I would not accept that at all. When you have a first wave that is substantially different from the second wave, it's appropriate to go and check and to do the deep analysis, not by me, but by doctors who are not just public health experts, but infectious diseases experts and experts in how hospitals work. Consult with unions, consult with workers from aged care, from hospitals, clinical roles, non-clinical roles. A massive piece of research that Professor Andrew Wilson, the head of the Chief Medical Officer who's in charge of these matters, stood at this podium and took everyone through some weeks ago. The two waves are very different. In the first wave, we had something like 70-odd+% of infections were not from the hospital environment. They were from the community. Flip that around, though, when you get to the second wave. It is a much higher number. It is very similar to that number within the hospital. And in some respects, that stands to reason because we've got more patients in. And this thing is wildly infectious. And the term healthcare worker doesn't just apply to hospital staff, it applies to aged care staff as well. So I would not accept that comparison. I'd simply say to you that there's a massive team getting PPE out, driving constant improvement. Every single day, people are in every hospital, they're looking for ways to improve. And I'm very grateful to them. They're doing a very good job. Those who have become infected, those who are out there or been furloughed, those who are working shifts as we speak in hospitals across the state, we're deeply grateful to them. Deeply grateful to them, and every single thing that can be done to keep them safe is being done. But you can't make it absolute. This thing is so wildly infectious. There's no greater commentary on the infectivity of this thing and the fact that it's silent and moves rapidly than the fact that hundreds of healthcare workers, despite the fact that they are head to toe in PPE, with all the protocols and practices that you need, they are still getting this. That speaks to how infectious this virus is. And it speaks, I think, pretty clearly to the risks and the dangers of opening up too much too soon.
Speaking of hospitals, have you tied any of the steps to elective surgery? It continues to be a source of anxiety.
We will have more to say about elective surgery. We're doing some further work on that, and I know it's a very significant challenge to a lot of people who had been scheduled to have their surgery. That's been by necessity put off. It's about creating capacity, particularly so that private aged care residents could be moved to hospital where that was the clinical judgment. We'll get elective surgery back and we'll have a really significant blitz to try and catch up, but that isn't for today. We need these numbers to come down further before we can outline that.
Could it come back for the regions first?
That is possible, and we will have more to say about elective surgery, which will include the metro-regional split as soon as possible. I would just say Category 1 is still occurring, urgent Category 2 is still occurring, and on a broader theme, because you can never say this too often, people should not be putting off their medical care. If you need to go to your GP's safe. They're working as hard as they can to make their surgery safe. They take it so seriously. Your health is so important. If you need, for whatever condition, particularly for non-COVID related conditions, you can't put those things off. You've got to come forward and make sure that you get the care that you need. There are many people attending emergency departments, but there is a bit of a trend. Some people perhaps attending later than they should. Not ignoring symptoms, but not acting as promptly as they might. We don't want any more adverse health outcomes. We want people to get the care that they need. And anyone who is in any sense putting off getting that care, I just reassure you, everyone in the health system, including GPs who are doing an amazing job, they all take infection control and safety very, very seriously, and everyone will go to the best of their efforts to make sure that you get the care you need. But you, of course, have to come forward and get that care. No one should be putting off their care. They should be coming forward and getting it.
The Prime Minister has made a call to Anastasia Palaszczuk, urging her to let a young Canberra woman out of hotel quarantine so she can attend her father's funeral. He passed away while she was quarantining. Anastasia Palaszczuk now claims she was bullied in that conversation. What do you make of that?
I'm not aware of that conversation or the Premier of Queensland's comments about it. I think the two people on the call would be the ones who would be best placed to describe it. I really can't do that.
Do you think that woman should be allowed out to attend her father's funeral?
That's entirely a matter for Queensland authorities. I'm not for a moment diminishing how traumatic and how difficult that would be to lose a loved one, to lose a parent at this time of, in 2020. Very, very challenging year. But it would be even harder if you had lost someone that was that close to you and you were not able to come together in a big, large family, friends, to come to celebrate that life, to get the very personal support. Sometimes a hug can mean an awful lot at a time like that. That's just not possible at the moment. It's really tough, really tough.
Can I ask, Premier, across the pond in New Zealand, the Prime Minister Jacinda Ardern says you and her have been having regular conversations. What have you learnt about what's happening in New Zealand and how have those conversations impacted how we're handling things here?
Well, I have a very good relationship with Prime Minister Ardern. She's a good person. She's a fantastic leader. But having said that, and your question should not in any way infer that we are pursuing a New Zealand strategy. We are not.
No,
We simply are not. So we will talk from time to time. I connected our public health teams very early on. For instance, the most recent discussions we've had, not the most recent, but the most recent substantial discussions, were about making sure that the Victorian Infectious Diseases Reference Laboratory, which has not just the genomic sequencing for the virus that's been experienced in Victoria, but has all of those sequences for all the virus across the country, was connected with their equivalent in New Zealand. Because you'll remember, there was some thought that maybe the Cool Store over in the West had perhaps been linked to the outbreak in Auckland. That was the most detailed discussion I've had more recently. We've had some other conversations since, but she's a fantastic person. I get along well with her. If we could share information and insights, we do. But please, no one ought to read that into us having adopted anything other than the National Cabinet setting, which is to suppress this virus, to find a way to live with it. And I'll just go back to the central point. You cannot keep the numbers low if you don't first get them to a low level. You've got to get them down so that you can keep them at those low levels, not for weeks, but for months and potentially for the entirety of 2021.
I'll just get Alan to clarify something really
Sure.
quickly. Alan, you mentioned that the caseloads attached to the steps weren't necessarily hard and fast rules, just for everyone trying to get to the same goal. What are we going for here? For example, regional Victoria's under it, but obviously mystery cases are still there. But is there anything else beyond those two?
Yeah, so it's things like, how many unknown source cases, the short-term trend. So, if there were 5 cases on the last day, we'd be obviously a little bit more worried. Whether those cases were linked or they, all over the city, what setting they're in, sort of the contacts of those people. Are they in places that there are large numbers of contacts and we're going to have to have a lot of people in quarantine? What age they are, and is it in a very sensitive community or sensitive setting? So there's going to be a lot of things that go into that decision, and a number is clearly something we need to aim for, and we'll be looking very closely at. But if the last 7 cases, it was 7 cases, and the last ones were in a setting where we were pretty confident it was a closed community, an aged care facility, for example. Hopefully not. And we were confident that we had all those cases, then we might say, that's our judgment that it's probably safe then. But what we really want to do by saying numbers is, we're not talking about 20, we're not talking about 30, we're talking about, 5 cases a day or in that sort of ballpark.
And we've heard a lot about percentages about a third wave coming back, but what has the modelling shown our chances are of actually hitting these targets and getting there by October 26 or November 23rd?
Yeah, so, I think the date is probably, I'd say it's sort of like a due date for a pregnancy. Only 5% of babies are born on their actual due date, and there's a range before and after. So it is going to be sort of, around that time, but, plus or minus a week or so. And the modelling suggests that the chances are good, but there are going to be a whole lot of other things that we're going to have to take into account, like, where those cases are, and that's going to go into that judgment. So I don't want you to take a sort of an exact number away, because that's not how, the chances will work. There's going to be a judgment as we get closer to it. How safe will it be? And when we think it's safe enough, then we'll be able to transition.
And I know our contact tracing team or representatives are heading up interstate tomorrow. Is there anything you're implementing, say, in the last couple of days that's already seen an improvement?
Look, at the moment, the team's working on this new test tracker, and that's going to take a little while to bed down, but it's certainly being piloted. A lot of work's been done just over the last couple of days. But there's an enormous number of things that, there's continuous improvement down, but so we're really trying to, being piloted. A lot of work's been done just over the last couple of days. Extra minutes, but there's an enormous number of things that, there's continuous improvement down, but we're really trying to being piloted. A lot of work's been done just over the last.
Have you got any statistics on the proportion of people who've been on ventilators who've died? And I guess coming out of that, there seem to be a large number of, I've been contacted by relatives of people in aged care facilities who've been told that, I guess they've put it to me that they were asked to sort of sign pieces of paper saying that in terms of end-of-life care, meaning that they wouldn't be put on a ventilator or in intensive care. I guess what's the rationale for deciding whether someone gets put in intensive care or on a ventilator, and could some of these older people have been saved if they'd gone into ICU or been put on a ventilator?
Yeah, so I'm a hospital doctor, and this is a conversation that we have all the time. It's about when people come in, what is it that they want? What is it their family wants? And part of that decision, or part of that discussion, is what is likelihood it will actually change the outcome. So the chance for a 20-year-old that goes onto a ventilator getting out and recovering is very different to a much older person, for example. But it's not just an age thing. So, there are very healthy 70-year-olds who might be, quite strong and don't have a lot of other problems, and they don't have very severe illness. And then the decision might be to say, well, it's appropriate to, and if that patient wants it, to say that, it's okay to go into intensive care if that's required. But not everyone wants to do it. It's, intensive care is not a pleasant place, and it's particularly not how people want to see the end of their lives sometimes. And that's completely appropriate, and that's a decision between, the teams that's treating them and the patient and their family.
Alan, given half all the active cases roughly are aged care related, would it be better to try and move most of them into hospital situations to really ring-fence this issue? Yeah, it really is an assessment at the time. There are downsides in people being moved, particularly older people who may be frail, and moving them to hospital is not always in their best interest. And there are plenty of aged care facilities where they're very effective at managing outbreaks. So just remembering, an outbreak in an aged care is a single case. So if there's one single case, we call it an outbreak because it needs that response. 752 to 1,400.
Yeah, so but the point I was going to make is that of the outbreaks that have occurred in aged care, 40% were a single case. That means that all those facilities managed them very well, and there wasn't any transmission on from there. Obviously, we've heard about ones where it hasn't gone so well, and in many cases, because of the infrastructure, it is required that it is, to control the infection, that people are moved out into hospital. But that really is a decision on a case-by-case basis.
Can I just confirm, we get asked this quite regularly, are you allowed to sit on a park bench while you're out for exercise? There seems to be a bit of confusion over the rule.
So if you're exercising, then is one of the permitted reasons. Clearly you have to stop occasionally, and to rest while you're exercising is going to be fine, but not to linger for lengths of time if you're not exercising.
What do you have to say to other epidemiologists and your colleagues who have come out and said that given all the other restrictions in place, there's not much to justify curfew significantly limiting the spread of disease? What do you say to them?
Look, I think the settings are, at the moment, the settings that are in place are working. So, it wasn't that long ago that we had 500-700 cases a day. We now have 50 cases a day. It's sort of 1/10 of that. All these things that we're doing are helping. As time goes on, as those case numbers come down, we will need to necessarily need to revisit those to try and take off the most restrictive of those, allow people back to work. But that time is when it's safe to do so. Otherwise, we'll sort of end up in the same place. So there are a whole lot of things that are required at the moment, and hopefully we won't need them for too much longer. But we just need to stay the course just at the moment, just to get those numbers down a little bit further.
Can I just ask about testing, Alan? What have we learned about testing in the second wave in terms of where to do it and who to test? And is it fair to say, considering we didn't manage to suppress this second wave, is it fair to say that we weren't necessarily testing the right people in the right places back in July?
I don't think that. So the case definition, so the symptoms, the list of symptoms that we ask people to come forward and get tested for hasn't really changed a whole lot. We have learned clearly a lot of things since the beginning of this. So an example of that was the loss of smell wasn't picked up very early on, but people were telling us certainly early on, as things went on, that was a prominent symptom, and when that was looked into, it was thought to be quite a reliable symptom. So I think that's one example of how things have changed over time, and testing practices have changed. I think another thing that we've learned is that in a lot of sensitive settings, so abattoirs and aged care for that matter, that we really need to take a very aggressive approach to finding contacts. So we'll often test people that don't quite meet the the close contact definition of 15 minutes. So if it's someone on the same shift, we'll often test them just to make sure that we're not missing them. So we are taking a more aggressive approach in some settings, and that's sort of as we're learning, what's happening, and as evidence comes in, we need to change practices as well.
Last question. Premier, just on today.
Yes.
Are you okay?
We have got a clear strategy. Whether it's a popular strategy is not my concern. It's an effective strategy we need, and that's what we are delivering. And I'm grateful to every single Victorian who's playing their part. They're doing an amazing job. This is not easy, but the reality we face cannot be denied, it cannot be ignored. And just because we want it to be over doesn't mean any of us have the luxury of pretending that it is. The only way to keep numbers low is to get them low, and that's what these settings are all about. It only works because of the amazing efforts of so many Victorians, and I'm so proud to think that Victorians are staying the course. It's tough, but this is the only option. It is the only option. We've got to drive these numbers down as low as we can, and that gives us the best chance of opening up and staying open. That is the mission. That's what we want to do, and that's what we will achieve, because I think Victorians are equal to this, and Victorians will stay the course. They will not let their frustration, which is considerable, they will not let their frustration get the better of them. We've got to defeat this second wave properly, and that's exactly what we'll do, but only because of the efforts of Victorians, and I'm so grateful to every single one of them.
Is it time for a breather, just for yourself?
Rich, I've already answered this question a few times, and I thank you, and I thank you. Thank you for the acknowledgement that it's, I don't know how many days it is since you last asked me. The key point is this: I won't ask people to work harder than I do, and I've got a big job to do. We all do, and we need to get this done, and that's exactly why I stand here. I think it's an important part of my job. It's not the only part. I wish, as I said the other day, that it was just an hour and a half with you wonderful people every day. That'd be terrific. But there's a lot of other meetings to get onto, lots of other work to do, but this is an important part of it. There'll be time for a break when we have defeated this second wave. And at that point, I'll inform you of that when we get there. In any event, if there's no other questions.
I've got one more, sorry. Just
sure.
About local council elections. guidelines have come out after the roadmaps. It's big. There's lots of people that are trying to campaign.
Yeah, absolutely. I'm not,
How
sorry if
adamant are
my
you-
body language, man.
Yeah, I know
I'm
it's been a
taking your
long
question
time, and
absolutely
I've asked
seriously.
a
Be
lot.
very clear.
I know.
And your promise that it's the last one, too.
It is. Promise.
There's guidelines been brought out. I haven't seen those. To be honest, I have not seen those. That must be fairly recent. But that'll be to try and give effect to the Chief Health Officer's decision, or the advice, sorry, to try and make this as normal as possible. And to not, we have made some changes, but we didn't want to make any further changes. My understanding of those were that they would allow some campaigning, but it was limited in nature. The 5 kilometre rule, I think, was going to... that's what you're talking about?
Yeah. And so if we don't necessarily meet the thresholds, how adamant is your government that the elections will go ahead, and what kind of contingencies are in place if the case numbers don't go down?
Let me come back to you. I'm sure that there has been some contingency planning done. It's not an unimportant matter. I'm not... But there's a few things that I have to deal with every day. That's not one that's been brought to my attention today, but I'll chase it up for you. Any other issues? Very good, thank you. We'll see you tomorrow.